Here we have the superior view of the skull, also called the Norma Verticalis. In Norma Verticalis, we have the Norma Verticalis has the frontal bone, the two parietal bones, and the occipital bone. So the frontal bone and the two parietal bones, they articulate at the coronal suture. The two parietal bones, they articulate at the sagittal suture, and the two parietal bones and the occipital bone, they articulate at the lambdoid suture. So this suture is the coronal suture, this one is the sagittal suture, and this one is the lambdoid suture. The intersection of the coronal and the sagittal suture forms the bregma, which in newborns is basically known as anterior fontanelle. It's a membranous covering because the bones are not yet fused. So what's the clinical importance of bregma? It allows the head to pass during birth because the bones are not fused, and it also in newborns, if this anterior fontanelle is sunken, it means the intracranial pressure is low. That is, there is dehydration in the newborn, and if it's bulging outwards, it means the intracranial pressure is high. And this is called the lambda. It is the intersection of the sagittal suture and the lambdoid suture. This point, it's the lambda. In newborns, it's called the posterior fontanelle. The anterior fontanelle, it fuses at 18 months, while the posterior fontanelle fuses at 6 months. The highest point of the sagittal suture is called the vertex. We can see this is the highest point. It's called the vertex, and it is used for measuring the height of individuals. We also have the parietal eminence, the bulging part of the parietal bone. It's called the parietal eminence. These are the primary ossification centers in the fetus. And then we also have this parietal foramen, which allows the passage of the emissary veins. The emissary veins, they are communicating with the extracranial veins and the dural venous sinuses, the intracranial dural venous sinuses. So when the intracranial pressure is high, for example, when sneezing or coughing, the blood can flow from the dural venous sinuses to the extracranial veins. Between these two parietal foramen, we have the mobilion. It marks the point where the sagittal suture is more of a straight line. We have the Norma Verticalis interna, which, if we remove the skull cap, here's the Norma Verticalis interna. Again, we can see the sagittal suture. This is this part. This is the frontal crest. This is the frontal bone. These are the parietal bones. This is the occipital bone. Here we can see the sagittal suture. And here we can see the coronal suture. Here's the lambdoid suture. Now we can also see are the grooves for the middle meningeal vessels. So here, right beside the sagittal suture, we have the pits, the small pits for the granular foveoli. These are basically the points where the arachnoid granulations are present. Those are high pressure areas, so they form grooves. Also, there is this frontal crest, which is the attachment point for the falx cerebri. This part, this elevated projection, it's the frontal crest. We also have the sagittal sulcus. So this groove marks the presence of the superior sagittal sinus. This was all about the Norma Verticalis externa and interna.